Welcome to my practice. My name is Dr. John Flett, and I'm a passionate pediatrician who is dedicated to changing the lives of children with learning problems, children that think differently, learn differently, and have ADHD. And I've decided to make a series of videos to help parents answer the question, does my child have ADHD? Often the question I get asked is, how do I know whether my child needs an assessment? How do I know whether my child needs to see a pediatrician? Do I embark upon this journey? There's some concerns that I have. I'm not quite sure whether my child could have ADHD. So how does one go about answering that question? So what I've done is I've put together a few slides to help parents answer the question, does your child have ADHD? And you might think, well, maybe I think so, but I'm really against the medication. And I think from a parent's point of view, try not to think about the medication, but rather think about whether your child has this condition. Don't let the medication kind of blinker or kind of obscure your outlook and your motivation for getting help for your child. And I can understand from a parent's point of view, the big stigma about ADHD, the immediate thought is medication, and that's not what it's about. Only too often in my practice, I find I have parents come in that have had previous assessments. Their children are on medication, but they're frustrated. They don't really know why. The medication is maybe not delivering, not being used adequately, properly, and the wrong doses are given. So don't let your thoughts about the medication kind of cloud your overall feeling about treating ADHD. So I've put together a series of categories of problems I think that parents go through. It's a journey that they think about. So you might I've looked up, I've tried to find out information, I've done a lot of reading, but I'm not sure because it's very confusing. I find even with general pediatricians or other doctors, general practitioners that deal with this problem, in my opinion, I don't think they really have a deep understanding. And as a result, they find it difficult to translate that information to you as a parent. They have difficulty in helping you understand. And the first question I ask parents, what do you understand by ADHD? And parents have a lot of difficulty trying to give a very simple idea. And, a lot of very famous scientists have said, if you can't explain it simply, you don't understand it. And I think that is what I start off. Just ask some simple questions. So the other question is, often the teacher sees one thing and I see another. I don't think there's a problem, but the teacher seems to think there's a problem. Or the teacher has a problem and I don't really see a problem at home. Or, maybe both of us see a problem. So that's a common overall question that needs to be answered. And that if both parents and teachers see the problem, or if a parent sees the problem at home, really then I think you're probably more motivated to do something about it. And when there is a problem, I think often parents tend to think, well, maybe it's just a phase. It's a phase that a child will go through, particularly if it's a boy. Boys will be boys, a bit of a behavior issue. And I come back and say this so often, particularly mothers and women have such a low expectation of boys and men that, they put it down to just the male species as a sort of a lower form or a less evolved form of life. And kind of think they'll just go through this. Let me just sort of plow through it. Let me just sort of kind of soldier on through the problem. And hopefully, if I put my head in the sand, it'll go away. And this often doesn't happen. Don't let that happen to you. Don't let that kind of attitude that it'll just pass kind of stop you getting help, because it's not going to go away. And then how do you take the first step to getting help? Like everything, it's inertia, isn't it? You think about it, analysis, and paralysis. And it just stops you getting past that first hurdle. So this is what I'm also going to try and help you, is How do you take that first step? For someone like myself who's dealt with this for 20-something years and dedicated myself over the last 5-6 years almost exclusively in my practice, I see a wide range of children right when they have early symptoms, 3 and 4 years of age, and I've got children in late teens and even early 20s that I still see with this problem. So I have a deep understanding and have a real passion and empathy and understanding for parents and children and adolescents and young adults with the problem. So how do you take the first step? And that I'll help you understand. So, you answer the question. I think they might have this one, but how about the medication? Parents want to know whether there is a natural alternative. Well, let me try and answer it this way. If you really understand what ADHD is about, then you'll understand that it is a serious condition. Would you go with a natural alternative to treating epilepsy or diabetes? ADHD is a biochemical problem. It's a medical problem. And if you really have the problem and it is severe, it does need treatment. Not only medication, but medication really is the fundamental cornerstone of getting help and changing. And the earlier you start dealing with the medication, the earlier we start managing it, the less medication, and there is the potential for your child to come off the medication a lot sooner if you start early. So unfortunately, there is no natural alternative. It's almost kind of saying to somebody who needs glasses, who is nearsighted, who can't see the board at school, why don't we try a natural alternative to just squinting for about 6 months? So try and overcome that mindset of I want something natural, go and panic buy vitamins and a warm and fuzzy aisle in a health shop and try and, deviate and try and pretend it doesn't exist. Think about, is your child malnourished? Do they lack a vitamin? It's not a sugar problem. It's not a preservative problem. It's not a nutritional problem. So don't have that mindset of trying to treat a medical problem with a natural alternative. Unfortunately, there is no natural alternative. Another very common question is, I don't want my child to be a zombie. To be honest, I've never seen a zombie in my practice. And I think if your child is on medication, or you hear other kids or you see other kids on medication, doesn't mean to say that when I deal with the problem, your child's going to land up losing their personality and looking like a zombie. I'm not telepathic. I need communication, and that's the important thing, is between yourselves as a family and child, the teacher and the doctor. When we have the right information, we communicate, we don't end up having children that have side effects on medication. It has the potential in the wrong hands to cause problems. So put that out of your mind. With my approach, you're not going to be a zombie, and your child's not going to lose their personality. Parents have this feeling that I like this, dynamic, spontaneous part of their personality. I don't want them to be doled down like some robotic controlled cyborg on medication. And it's not addictive. It really is not addictive. I hear, that it's a Schedule 6 medication, so it must be addictive. Well, it's a Schedule 6 medication because it's a stimulant, and stimulants can cause a little bit of a buzz if it is abused. So that's why it's controlled, not because it's addictive. So that is a false perception. How about the safety aspects? In the right hands, with the exclusion of medical problems that can cause problems, it's an incredibly safe medication. When I think of a lot of other medical conditions like epilepsy, diabetes, even certain cortisones that are used for asthma, ADHD medication is incredibly safe if it's used correctly. But you've got to monitor things. You've got to give it at the right dose, not overdose, monitor weight, blood pressure, pulse, exclude medical conditions, underlying heart conditions. It needs to be managed by a specialist. So if you want the best for your child and you want your child to get the best treatment with the safest profile, think about going to a doctor that is specialized in this area. So the next major category is, you've looked up information, but I'm not quite sure. So how do you know for sure whether your child has ADHD? Well, you can do lots of information searching, but the important thing is find the right doctor. In my profession, I don't know a lot about the financial industry, so I've got to go out and I've got to have a trusted accountant, and I'll go out and I'll get the right person, somebody I connect with, somebody that I have a good relationship with, and that I trust, and I've got to put my trust in that person. It's good to ask questions. I certainly do challenge my accountant, but it's important to put your trust. You need to have the right person. The internet is like a Turkish bazaar. If you've ever been to Istanbul, the Great Bazaar, you're going there and it's just a cacophony of sound and information and confusion. And you need a guide, and that's what I am. I feel like I'm a guide. I'm a sort of a tour guide that's going to guide your child through the process. You've got to trust that guide. And how is ADHD diagnosed? ADHD is not diagnosed with lots of blood tests. It's not pulling liters of blood and bankrupting your medical aid in 4 minutes and sending you for hundreds of tests. I'm afraid the less experienced the doctor, the more tests they're going to do. And often when I see children, they've had lots of blood tests, because I think there's sometimes a perception from patients and parents that, whoa, this doctor did so many tests, what a good doctor they are. And look at all this medication I've got, look at all the vitamins I've been given. What a good doctor. I think that is such a naive, immature, and ignorant way to understand ADHD. ADHD is a clinical diagnosis. You need to have somebody who has the most amount of experience, who does things properly, who has a good system to approach ADHD. And, very seldom do I do tests. When I suspect some children who have underlying epilepsy or something called subclinical epilepsy, often when children come to me and they're daydreaming in class, sometimes I think teachers sort of feel that every child that daydreams and is in a little bit of a different world has petit mal epilepsy, needs an iron assessment, and needs an EEG. And sometimes psychologists also say that, and that's not necessarily the case. Petit mal epilepsy is where a child is for almost 3 seconds unconscious, like, they got no contact. Not that they thought they sort of in a different world and daydreaming. Inattentive type ADHD are kids that daydream. They're the only children that over the last 18 months have been on overseas trips in their mind, wonderful overseas trips, and sometimes they can look like they're in a different world. Is ADHD, or is it just man-made? Think about ADHD as a distribution of different heights. Say, for example, your child is 7 years old, or they could be 10. And in the class, you see a child that's very short. And you might initially think, whoa, maybe that child is very immature, or maybe the child's too young for the class. And when you confirm that that is the age, and the child's literally got the height of somebody who is maybe 4 or even 3, that's a medical problem. There's nothing wrong with the child's intelligence, they're just short. And ADHD is a developmental problem just like height. There are children that concentrate well, who have self-control, and the symptoms of ADHD is an immaturity. That child is behaving like somebody who's much, much younger. And when we get to the stage where those symptoms are so extreme, that is when we call it ADHD. And there are brain scans, there are so many research papers. It's accepted in 176 countries in the world, where there is consensus by world authorities and organizations and scientists that have made declarations on the authenticity and realness, if you like, of ADHD. We've identified 7 genes, 2 of them in particular, DRD4, DAT1, which have been identified. And so it is a very real condition. You can't see it, you can't touch it. Previous generations didn't know about it. So as a result, it's often looked at as something that is just a figment of an imagination of the medical profession. So, your teacher might see one thing, you might see another. The teacher will see your child in a different environment. You're not there to organize your child, dress your child, do everything for your child. They've got to do everything on their own at school. They've got to sit. They've got to do tasks that are not necessarily interesting. So a lot of the problems might not necessarily be observable at home, but they are definitely seen at school, where they have a child has to do something where they don't necessarily get immediate reward and it's not necessarily immediately exciting. So these are problems which might only be seen at school. Don't necessarily blame the teacher, and you say to yourself, well, the teacher last year didn't see the problems, but my goodness, this lady this year, she's got it in for my child. She's the one that has the problem. You've got to be open to look at why your teacher's saying these things. Teachers don't sit and victimize children. They want the best for kids. So, it's not just the teacher. And, just because you might not see things at home, remember, under certain circumstances, certain mental sort of tasks, this is when your child will need help. And, this is not due to a lazy or naughty child. ADHD children, they just can't. They don't have the ability to do the things that normal children do for their age. They're immature. It's like having a child who's 30% younger. They're not behaving in a naughty or lazy way. Just because they do things well once, because they can. When parents get upset with their kid, they know that their child can do things. If you have a child that's mentally retarded or a child who has like Down syndrome, you're not going to expect your child to do things that they can't do for their age. Your child is somebody who's immature in their self-control. It is a self-control disorder. It is a self-motivation disorder. And this is not a problem of bad parenting. It's not you that is the problem. This is an immaturity of the self-control center. It is not due to bad parenting, bad teaching, and it's not due to bad nutrition. So a lot of parents wish and hope that this is just sort of kind of an ostrich with their head in their sand, that it's a condition that'll pass, and if I just ignore it, it'll go away. How long does it last? ADHD is a lifelong condition. 60% of children will still have ADHD as adults, and 80% will have it at high school. But 20% won't, and 40% as adults won't. The earlier we start managing it, you change the course, and we can curtail the symptoms early on if it's treated very early. ADHD is not an information deficit disorder. I get very frustrated when teachers and sometimes psychologists, they think by talking to children that they can overcome this problem. It is not a problem of knowing, it's a problem of doing. Going to play therapy is not going to help build skills. They have the ability. This is a problem when you do, not when you are, in other words, telling children, writing things down, you can turn purple telling them. They're not going to do, because it's a problem of poor working memory. They're unable to hold in mind those instructions. It's not that they won't, they just can't. And when your child says, I won't do things, well, that's probably when they're naughty. But they just can't. They're unable to manage things. They give into the immediate gratification and needs. So, play therapy does not help this condition. And of course, a little bit of attention, a little bit of concentration, hyperactivity, doesn't sound like a serious condition. The name belittles, unfortunately, the condition. It's probably not a great name, ADHD, because it doesn't tell you the severe consequence of the problem. 38% of untreated girls have teenage pregnancies, twice the death rate during childhood of children if untreated, as well as adulthood, because it's impulsive. They don't think, they don't look after themselves. Poor academic performance reduces your long-term ability to be successful in careers. Don't look after your own health. Impulsive eating. Don't think of the consequences in the future. Health consequences. And of course, social, emotional, divorce, criminality, oppositional defiance, anxiety, depression, bipolar. I could go on and on. Parents say, well, look, this wasn't a problem when I was at school. I think you've got to be honest and think to yourself, if you were being given the opportunity that your child has now, wouldn't it have been an amazing ability to change the outcome of your child's life? And maybe your own. Parents often, when I help them understand truly what it is, they really start to understand and often ask the question, is it too late for me to get help? No, it's not. But think about the help that you could have been given, because often these are genetic conditions. There's a increased chance that if your child has ADHD, that you too have ADHD. So there's a huge chance that one or both parents have the problem. Think back to your own schooling and what you went through. Always feeling like an imposter, poor self-esteem, not really achieving, always giving the bare minimum, giving in to things that are the quick fix results, not putting in a lot of effort for long-term benefit. So how do you go about getting help? And that's where Dr. Flett comes in. I am here to help you. The first step is to make sure that you book an assessment. I take at least an hour and a quarter to an hour and a half to deal with this problem. That is the physical time during the consultation, but it's the preparation beforehand that is vital. It takes me a long time. You need to start gathering information, reports, school reports, samples of work, assessments that you've had done. Complete the online assessments. We've got 2 websites, guyllittleminds.com, but go to drflett.com, and under assessments, there is a section for teachers as well as parents. There's even a free assessment for parents to do an ADHD assessment from an adult point of view and assess your own risk. And it's about information sharing. I feel like I'm a detective. You've got to give me lots of pieces of information so I can build a case. It's like doing a big jigsaw puzzle. The more pieces you give, be open, honest, say what you think. Remember, you are the parents. That is your child. You can say what you like. It's important to really dig deep to the depths of your heart and understand, because I find unless you understand, part of the assessment is understanding. If you know what to do and what the problem is, it's like a veil that's been sort of removed from this obscurity and confusion, and you can move forward. And remember, the teacher's information is so vital. Honestly, it's the cornerstone, because, neither you or I are in the classroom. We're not able to see what goes on. And remember, I need both parents as well as your child to attend. And this is the start at the end of the consultation, the assessment, to start changing your child's future. So please don't hesitate. Please make the appointment and let's start changing your child's life.